So how do I know what supplements to give patients? What I've done is I've created this protocol or lab set called Brainwell Labs. And that's where I look at to determine what supplements to give, what medications even to give, as well as correlating the results of the labs with the genetic testing. So that's where it comes to the integrative. This is where you can't just, oh, you're going to treat B12 deficiency. But if you don't concern yourself with maybe they have low COMT, you're going to make that patient more anxious. So in the general things with the, I check basically all the same things as any other medical provider does. CBC with diff, I can find a lot of things that in there that can tell me why people will feel bad or tired. CMP, I need to know, do they have normal kidney functions? Do they have normal liver functions? Because we have to be careful in some of these medications, even supplements. We have to be careful in what to give to patients if they have failure in their liver and their kidneys. As with any standard care in psychiatric treatment, especially if we're going to talk about giving them atypical antipsychotics, we need to check the lipid panel. We need to check the hemoglobin A1C because we want to know what their metabolic profile is to make sure that they're continuing to be normal while we treat them. And sometimes I'm not against giving psychiatric meds, especially with atypical antipsychotics, because this is very useful in certain genetic conditions, as we discuss. The next thing that I look at, of course, your vitamin levels, B12 folate, but not just that. I look at the metabolism of it and the homocysteine level. Not 100% that you're going to see elevated homocysteine with MTHFR deficiency. There could be something else brewing in there, but in general, homocysteine can be elevated not only with MTHFR deficiency, the C677T phenotype, but B12 can also cause it, and folate deficiency can also cause it. MMA, which is methylmalonic acid, that is specific for B12. I'm going to talk later about it when I talk about some supplementation B12, why it's important. It's not just saying, okay, their methylmalonic acid is high, and it's because their B12 is low, and then you just automatically give B12. There's a reason why I check these things, and I'm going to discuss that further along. Of course, with vitamin D, lots of mental health issues, even depression. So the latest journal finally proved, giving vitamin D to patients with depression can actually be of benefit. And not just because of, osteoporosis risk and so forth. Vitamin D is considered a hormone as well as an antioxidant because it brings down inflammation. Iron, it's important to check iron in a psych patient. What if that's the only reason why they don't want to do anything? They feel tired. They look depressed. Zinc is important because if it's too low, then it can affect hormones, as well as it can have a problem with perpetuating inflammation, because as you know, zinc also is an anti-inflammatory mineral. Magnesium, the same thing. It is pretty critical when I'm looking at somebody who has problems with ADHD, anxiety, PTSD, all those things. So the other thing that we talked about, inflammation, I do check inflammation markers, the C-reactive protein. And one of the things I do like to check is Epstein-Barr virus. It's very common among psychiatric cases. It's a funny virus because your body can still feel like as if it is full of inflammation from acute, although it doesn't represent that way. And what happens when you have too much immune reaction to it? You feel bad, you feel tired. And of course, we have to do drug screen on all patients. We got to really make sure that they're not using things that is going to prevent your ability to get the patient well. And the last thing that we look at in a Brainwell panel, which I added recently, is a hormone panel. And when I mean hormone panel, I mean like neuroendocrine. I'm talking about brain hormones, the hormones that are coming from your pituitary gland. They control everything in the periphery. along with studying your sex hormones, your thyroids, and your cortisol. The reason being, seeing that somebody is low hormone in the periphery, I'm not satisfied with that. I need to know, is it from a brain injury? Is it from inflammation? Is it something else that's going on that's preventing the brain from working right? Other things that I do look at also with thyroid hormones is reverse T3. Reverse T3 is inactive. Sometimes when people are complaining of fatigue, reverse T3 is too high, not enough active thyroid hormones, which is T3. Also, I look at Hashimoto's tested through TPO. There's even a correlation with Hashimoto's and vitamin D deficiency. I was able to get somebody's TPO to normal by giving them a higher level of vitamin D or getting them to a higher level of vitamin D. And of course, ACTH and cortisol, we need to check that. You know, is the patient stressed out with something, but I want to know why your cortisol is high. Is it coming from the brain? Or is it coming from the adrenal gland? Or is it stress? And so let's talk about the first thing that we do in our brain well panel: iron deficiency, fatigue, shortness of breath. You can have cravings for ice. This is very common in pregnant women. You know, they have this concept called pica, but it can also cause restless leg syndrome, which is what exactly happened to a patient when she told me that, yeah, my iron is low and I'm getting restless leg. You know, you don't give them Requip. You treat the problem, the iron deficiency, and let's see if those symptoms go away. So in terms of treating it, iron, 325 milligrams a day, but these are the things you need to tell your patient. Take it on an empty stomach. Don't take it with antacids because they will prevent the absorption. And then vitamin C does help the absorption of iron. Of course, one of the reasons why some people can't tolerate constipation, even if you give them stool softeners, but we try. And of course, it does cause black stool, but that's completely harmless. It's just the color of the iron.